Functional re-education training focuses on reteaching activities or movements that a patient once knew but can no longer perform properly due to illness or injury. The main goal is to help patients regain independence by retraining their bodies through a sequence of progressive positions, similar to how a child develops from lying to walking. Functional re-education programs are beneficial for orthopedic, neurological, and cardiac conditions. They help improve coordination, balance, muscle strength and endurance, pelvic and postural stability, proprioception, and ambulatory skills. The training consists of perambulatory mat exercises and ambulatory training, progressing through various positions: rolling, supine to side lying to prone, prone to side lying, elbow prone lying, hand prone lying, quadruped, side sitting, sitting, kneeling, kneel sitting, half kneeling, standing, and walking. Most exercises begin in the supine position, which is stable and comfortable for long periods. Bridging is a key exercise to improve trunk and pelvic stability, starting with assistance and progressing to independent and resisted movements. Rolling from supine to side lying is practiced with assistance, using coordinated movements of the arms and legs. This movement is useful for bed mobility, preventing bed sores, and progressing to other postures. Transitioning between side lying and prone positions involves coordinated use of the upper and lower limbs. These movements are important for bed activities, postural drainage, and strengthening exercises. Elbow prone lying is achieved from prone lying, with the upper trunk supported by the elbows and forearms. This position improves upper limb stability, dynamic balance, and is useful for activities like bed making and dressing. Hand prone lying is an intermediate position between elbow prone and quadruped. The body is supported by the hands and wrists, increasing the challenge for stability and coordination. This position is useful for paraplegic patients to improve upper limb strength. The quadruped or forefeet position is the first in which weight is borne through the hips. It can be achieved from hand-prone lying or side-sitting and is essential for practicing crawling and improving neuromuscular control. Elbow side lying is an unstable posture, often used as a transition to side-sitting. Side-sitting is more stable and allows for weight bearing through one upper limb and the pelvis, useful for floor-level activities. Long sitting is a stable position that requires good trunk strength. It is achieved from side sitting and is used for various strengthening and balancing exercises, including hitching and hiking movements for pelvic control. Kneeling is achieved from quadruped or side sitting and is less stable, often used for mobility and dressing activities. Half kneeling is more stable and serves as an intermediate posture between kneeling and standing. Standing is an unstable posture that requires support initially. Training progresses from standing with assistance to independent standing, then to walking, often using parallel bars for safety and support. Parallel bar walking is introduced once motor control in standing is achieved. Activities include weight shifting, one-leg standing, hip hiking, stepping, push-ups, turning, resisted walking, backward and side walking, air cycling, and step-ups.